Good morning to everyone. It is a great pleasure for me to be here with all of you today. So thank you for the invitation, and also thank you for giving me the opportunity to address all of you today. When I prepare a presentation, I try to find always what is that word, the word that really is at the core of this presentation, that uniquely describe that what I have to say. When preparing this presentation for today, the word that came to my mind was momentum. I will be talking today from a WHO perspective. And I want to tell you why momentum is that what I want to talk about. It is because WHO, when thinking of eye care, is taking the advantage of the momentum that is being created by the new global context and what we in the last months have been saying, new World Health Organization. We also are not only taking advantage of the momentum created by the global context and the new WHO, we are also creating momentum for eye care at the World Health Organization. And that is what I want to present to you today. A new global context. And I put new in quotations marks because you have been hearing very often already in the last 2 years about this new global context. This is the context of the Sustainable Development Goals. But it is important to have it present because it is the agenda that is determined, the agenda of all of us, of UN agencies, of civil society, of the private sector, and every single individual of us. It is an ambitious agenda because it pretends to tackle that is what is most difficult in development, namely that it is sustainable. And it intends to tackle all the barriers that are in the way of development being sustainable. For WHO, the goal that we are focusing on is our core mandate is the goal of health, ensuring healthy lives and promote well-being for all and all ages. And it is a very good goal to work on. It is also the goal all of you, all single one of you is working on. And it is a good one because no one would argue that health contributes to sustainable development and sustainable development contributes to health. And when we talk about the goal 3 and its targets, we describe it with 12 targets plus 1. Plus 1 because there is one single target that is the motor, the catalyst for all the other 12. Without this one, the other 12 we know would not be achievable. We would not achieve health for everyone, everywhere, if this target is there, because then the development would not be sustainable. And this target, this fundamental one, is universal health coverage. So let me spend a couple of minutes in the concept of universal health coverage. What are we really talking about? We are talking about, first of all, quality. Sorry. So let me tell you now, link the concept of universal health coverage to the mandate of WHO. I was too quick in my thinking. So we have, because I'm presenting the global context, so it is the context of the Sustainable Development Goals, but now I have to introduce to you why we are talking about a new WHO. We have, since May 2017, a new Director General. And a new Director General always presents at WHO a new agenda. And this is what we call the WHO Global Program of Work. And it is an agenda for the next 5 years. Should the Director General be re-elected, then this agenda will continue for the next 10 years. And the vision of WHO continue being the same. We want a world in which everyone, everywhere have the highest or achieve the highest standards of health and well-being. What this new Director General has put in the new global program of work is a new vision. It's about promoting health, it's about making the world safe, and it is about protecting the vulnerable. And in order to achieve this vision, we have now very clear strategic priorities. And you see now here the commonality. You see now here that we have decided our priorities so that we can achieve and we can be successful in achieving the Sustainable Development Goals and the one that we need to deliver on. It is advancing universal health coverage, is about addressing health emergencies, about strengthening the health of populations. And again, we could say it is in our strategic priorities is 2 + 1, because we know that universal health coverage is the fundamental one. So there is a clear alignment between the global agenda and the WHO agenda. And the unifying and core of these two agendas is universal health coverage. And that is the reason why I want to spend 2 minutes in universal health coverage. We are talking about the provision of quality essential services for promotion, prevention, treatment, rehabilitation, and palliation, provided according to the need, without financial hardship. Very often at WHO, when we present or when we talk about universal health coverage in countries, we tell them, imagine when you think in your country about universal health coverage, imagine a cube that has 3 different dimensions. The first dimension is the population that needs to be covered with health services. That is the whole population of your country. The second dimension is which services need to be covered. And the third dimension is what costs need to be covered to provide those health services. In an ideal world, the budget that the country has is as big as this cube, so that the whole population with all the services and without out-of-pocket payment is possible. However, that is never the reality in countries. The budget is always smaller. So that is when the negotiation starts. And how countries usually proceed is, first of all, we close the gap of the population that is covered. We intend to cover the whole population for at least a number of minimal services, with closing the gap of the out-of-pocket payment for those services, so that everyone in the population is covered for a minimum number of services. And then we start with the thinking of progressing realization, closing the gap of the services that are not covered. We have realized over the years, because the concept of universal health coverage, as you well know, is not a new one. We have realized over the years that the way how we have implemented so far universal health coverage has been extremely, what we could say, vertical, adding single health services to the services that are included in the packages of care for the population. Now the conversation is changing, and we are saying it is not simply about covering services, it's about having services that are integrated so that the population receive all these services, the people in the country receive these services, making sure that there is a continuum of care for promotion, prevention, treatment, management, rehabilitation, and palliation. And that all these services are coordinated across the different levels of the health system, coordinated also across systems, and throughout the life course. So it's not only about implementing programs and covering services in a vertical fashion, it's about how these services are coordinated. The mechanism that WHO has to make this possible is about strengthening the health system. We are aware that if we want to make universal health coverage a reality, we need to make sure that the system in a country works in a way that enables that. It is about having a good governance and leadership structure. It's about having the sufficient financing mechanism. It's about having a good information system to monitor. It's about having human resources. It's about having technologies, assistive technologies and assistive devices, and also medicines. We know that only if all these different building blocks are strong, they will be able to provide integrated health services. But we know also in the meantime that the integration of health services will work if we make sure that in each of the building blocks already integration is at the core. It has to be integration in governance and leadership, in financing, in health information system, in workforce, and in the planning for medicines and assistive products. And only in this way we will have poor and real integration. This is the thinking of WHO and how we think we need to strengthen health systems in the 21st century. And all the colleagues of the organization in the different departments are working with this mindset and are developing tools to support countries to make that possible. We have, in the meantime, very powerful tools, for example, like the One Health tool, to support countries to plan the health budget. And we are developing this tool with the thinking of integration. Exactly the same like the tools developed for health information system, the way how we plan the health system and policy research, the way how we talk about workforce, not anymore in terms of professions, but in terms of competencies, so that the conversation and the coordination is possible, and also powerful tools in the planning for assistive technology, for medicines, and also for governance and leadership. The reality up to now was that eye care was not integrated in these tools, and that was not considered in the conversation with developing then. And that is what we are changing. We are making sure that I care is part of the conversation and is integral part of these tools. And this defines the first priority for the team taking care of eye care at the World Health Organization, to make sure that eye care is integrated in all tools that are developed to strengthen the health system across the organization. What we also realize is that it does not work anymore for WHO working in silos, that the departments are coming together to provide this, are working together to make sure that the communication happens and integration happens. And in this conversation that our departments are having together, something that is being extremely strategically important is the way how we talk about eye care, and put forward a definition, and we have put forward a definition of comprehensive eye care that addresses or that is in line with this conversation of integration. This is also the definition that you will find once it is published in the World Report on Vision. We talk about comprehensive eye care as fulfilling eye care that fulfills three different components. First, a continuum of health promotion is the delivery of a continuum of health promoted prevention, treatment, vision rehabilitation intervention to address the whole spectrum of eye care diseases. It's about addressing the person's needs, about the life course, and it is about coordination and integration across the different levels of the health system and across sectors. As you can see, it is a definition that is completely in line with the definition of comprehensive services and completely in line on the way how we talk about universal health coverage, and that has been important. So that when WHO works now in a more coordinated manner among the different departments with the focus of universal health coverage, we are also in the conversation. And the way how we are working in a coordinated manner is to deliver universal health coverage is in such a way that we have even developed a universal health coverage platform. And we are also developing a universal health coverage menu, a menu that will contain all the interventions with which we go to countries and we say, if you want to implement universal health coverage, this is the menu of interventions that you should take into consideration. And what we want to make sure is that eye care is in this menu. And this defines our second priority. It is the development of a package of eye care interventions that it is integrated and it is intrinsic part of the universal health coverage menu, so that whoever in the organization go to a country to support ministries of health to deliver on universal health coverage has in each package, in its menu, eye care. And that defines our second priority in WHO for eye care. For the new Director General and for the new WHO, the message is also every country is important. Sometimes we have, sometimes we have been seeing our focus is always low or middle income countries, and this will continue, but the message is to now, we need also to broaden our scope and think of every country around the world. And what we need to think of when we develop our tools is that every country is in a continuum of maturity in terms of where they are in the health system. There are very fragile health systems, and there are very mature health systems. And that is something that we need to take into consideration. For very mature health systems, the role of WHO will be minimal. It will be in the form, for example, of having policy dialogues to plan the health systems of the future. In very fragile systems, we will work closely with the Ministry of Health and with the country to build outcomes and really to work together to make sure that the service delivery is provided. And in the whole spectrum in between, we need to make sure that we provide and we are equipped with the right technical assistance to make sure that countries build institutions, and also when the system is more mature, to build performing health systems that provide the care that the population needs. It's about every country, and then we need to make sure, and that is the challenge that we have, is we need to make sure that we have the appropriate tools to accompany countries when doing their planning, the planning that they go through. It is about knowing where the countries are in terms of delivering health services. It's about developing a strategic plan. It is about monitoring and evaluation, and most importantly, it is about implementation, how we implement the strategic plans, how we monitor those strategic plans in cycles, putting a lot of emphasis on implementation. We have been good in the eye care sector and assessing and determining the situation. We have also tools for that. We have been also relatively good in making strategic plans. Nevertheless, we need to be better on it, making a strategic plan that also talk very strongly about integration. And we need to become much better in monitoring and evaluation, and especially in implementation, and that is what WHO is taking very much at its heart. Developing those tools also for the eye care sector with the conversation of integration so that we can support countries in the appropriate way, and putting a special emphasis in monitoring and evaluation. So that I could say from a WHO perspective, our third priority is the development and implementation of a support package for countries. We are aware that we cannot be naive, that despite of all this work that WHO is already doing, and I would say at this point even the work that every one of us, of every one of you is doing, all of this could be a futile endeavor. It could be a futile endeavor because if one thing does not happen, then eye care and comprehensive eye care will not be in the game. As you well know, every country has a global strategic plan, and in the context of development, a development strategic plan. Within this plan, there is a health sector strategic plan. And in this health sector strategic plan, there is then the different topics that are relevant for the country. It is maternity and child health, it is HIV, it is aging, it is mental health, whatever the country set as a priority. we have to be aware that it can be a futile endeavor, all the work that we are doing, if we do not make sure that eye care and comprehensive eye care is in this health strategic plan. So we need to work together to make sure that eye care is in that in a strategic plan, and that it is part of the conversation when the country plans universal health coverage and the implementation of universal health coverage. The question is, how do we manage that, how we make sure that eye care is part of the health strategic plan of a country? And that is a question that we at WHO, we have also been struggling with. So what really it is, what can make sure that that happens? And talking with different stakeholders inside and outside the organization, and having several policy dialogues in as I said, inside and outside the organization, we came up to actually to reflect to the conclusion of something that is reflected into two papers that I would like to present to you as a background, and so that you can go back to them afterwards. The authors of these papers say, actually, what really makes a difference putting a health topic in the political priorities depends in 4 different factors. The first factor is, what is the actor power? How the stakeholders on a field work together with a strong leadership in the same direction. The second factor is the ideas. How consistent and cohesive is the conversation about the topic the health topic is about? In this case, eye care. How is the political context? Are there windows of opportunity that we can take advantage of so that we can make the point that this health topic is a relevant one, needs to be a priority? And the fourth one is the topic itself. It is an important and relevant topic. Do we have credible indicators? It is recognized as relevant. Do we have the data? Are there effective interventions? For the sake of the argument, I thought, okay, let me think how I think of the sector of eye care in all these different 4 criteria. Where you are, if we think from 0 to 10, where 0 is not fulfilled at all, 10 is the best it can get. And I would say, actually, in terms of the topic's characteristics, is definitely an 8. Who would doubt of the relevance of eye care? The second, the political context, I thought, okay, that is what we have been talking about. We have windows of opportunities. We have the Sustainable Development Goals. We have universal health coverage as a main topic that is implemented in countries around the world. So we have windows of opportunities. In terms of ideas, I wanted to challenge you a little bit and thought, okay, I think it would be a 3. Because I thought the way how we portray and how we talk about eye care is not so cohesive among the sector, and I will go a little bit more into that. In terms of actor power, I thought, wow, you already have done a great job. So you are really there in the higher levels of that continuum. So I think it's 7, and that you all are here is a demonstration that there is a lot of actor power behind. I would like to go a little bit deeper into the ideas, and justify my three. When we talk about ideas, we are talking about the internal frame, namely how the policy community that works at national level but also in the global context, agrees in the definition, the causes, the solutions to the problems of this sector in health, in this case of eye care. And the second criteria is the external frame, how we communicate about eye care to politicians and to decision makers, and are we effective in transmitting that eye care needs to be high in the political agenda? And I leave it there to you for reflection and for a challenging reflection. The question, the feeling for me, and also based on all the discussion that I have had with the stakeholders on the eye care sector, was three, and sometimes I have heard it could be even a one or a two. The important message here from a WHO perspective is that the World Report on Vision is a very powerful tool that can contribute to the cohesion of ideas and how we portray and talk about eye care, especially how we communicate to the external world of the eye care sector, and how we can take this World Report so that in the internal sector of the eye care, we also communicate in the same way. So that is one fundamental reason why for WHO this World Report is so fundamental. And this discussion on putting eye care as a priority in the health sector take a different conversation, or it takes a different perspective when we talk about momentum. Because it is not anymore the momentum that we are creating at WHO, it is really the momentum that we are creating in the field of eye care as a whole. And how we can really build on the momentum that we have and make it much more stronger. And we are aware that not WHO alone, nor IAPB alone will be able to create that momentum. But we can very strongly move it forward together. And that is where we are now at IAPB, in the collaboration between IAPB and WHO. We are really discussing, concretizing how we can collaborate together so that we build this momentum. And once we have discussed and sorted out how we could collaborate together, we need to be aware that we will also have to answer the question, which are the other partnerships that we need to take into consideration to move the field forward so that we create momentum in the field of eye care, a momentum that have a sustainable impact. Thank you. The urgency that we see at WHO, the urgency to really be part of the agenda, So it is for me what I would like to share is the reason why we are doing that, the way how we are doing that, and it is because we see the urgency of becoming part of the agenda. And I also want to share the experience that when we talk in WHO across the organization and the different departments, and we say, have you integrated eye care in your One Health tool for universal health coverage? And then the colleagues react, actually not yet. And if you ask why, I don't know. So it is, I don't know, but of course it needs to be there. And that is my message, is nobody argues, never have ever argues that eye care and comprehensive eye care, how we are talking about comprehensive eye care, needs to be part of the agenda. But we need to really make the effort saying, on communicating it, in saying it in a coordinated manner, because everyone will react in a positive way. Nobody will question it, but we need to really make the first step towards that end. Making sure and being confident that nobody would argue with that. And the second point is also related to that. Nobody would question never ever that eye care is intrinsic part of universal health coverage and need to be intrinsic part of universal health coverage. I have been puzzled very often by the fact of why it's still not in so many countries. And I think probably is the way how we've been talking about it, and now we have to change the mindset and change the conversation and not even ask the question anymore, but really approach with whoever we talk as, it is integral part of universal health coverage. It has to be integral part of the health strategic plan. How can a country think of not having eye care an intrinsic part of the health strategic plan, and really approach with this level of confidence that this cannot be questioned, it will not be questioned, and then is integral part, start communicating in that way. From our experience, and the experience that we are doing at WHO, it is not put in question. If we knock at the door, the doors are open. So this is my message. So confidence that this integral part communicating in that way. And the second point is also, as I said at the end, we are at WHO very much aware that we cannot do alone, the job alone, by no, so it is not even the intention, it would be impossible. And we are putting a lot of effort on knocking at doors, open doors, integrating eye care in all the different tools, having this conversation with colleagues in the context of universal health coverage. But we will have to join forces to make really a difference at the country level. And all these tools of the world needs to be taken on, exactly the same like the World Report needs to be taken on at the country level with policy dialogues, giving everywhere the same message, everywhere around the world, so that we really move forward in this momentum, having a sustainable impact.
Thank you. So we have two